a push in life. Anybody can be somebody, through development and building one's capacity, financially, health-wise. Everyone can be better, 'cause we're taking you higher, You can be entertaining, so educated, making you so independent. Through network consult, helping communities, network consult, individuals and organizations, network consult, network consult.
Good evening, Plateau. Good evening, Nigeria. Welcome to today's edition of Mind Wealth for Life and Living. My name is Dr. Emmanuel Innocent, and I'm your host for today's program. You are already acquainted with our program that Mind Wealth for Life and Living is an initiative of Network Consults to help you acquire the aptitude and attitude that you need for you to make success in every and any area of your life, be it marriage, business, career, politics, and even governance. We also help you to achieve and maintain a sound mind so that you can live the life of abundance that you deserve. On today's program, we will continue our talk on rape. And somebody might say, why are we obsessed with rape? We are talking on rape because we know that a lot of this goes on almost on a daily basis, and people might not even know what to do. Some are not able to talk about it until years later, when the gathering of evidence for you to get the perpetrators prosecuted and for the victims or survivors to get justice, that opportunity is usually lost. However, we want to talk about rape in the context and perspective of the forensic pathologist. What are the things that you are supposed to do when you fall victim of rape for one reason or the other, or you have your relative fall victim of rape? What should you do? Should you clean up and then forget about it, keep it hush? Or do you get to the hospitals and get things done so that eventually you can, even if you want to go to the law courts and all that, you can get evidence? So to discuss this issue and many more, I have a colleague of mine who will be joining me today to discuss the subject matter. But before we go on to the discussion proper, we'll go on a short break now. Stay tuned and don't go away.
Network consult. Everyone needs a push in life. Anybody can be somebody, through development and building one's capacity, financially, health-wise. Everyone can be better.
My name is Dr. Emmanuel Innocent. I'm a consultant psychiatrist and certified management consultant. I'm the Chief Executive Officer of Network Consult Training and Development. At Network Consult, we help individuals, organizations, and communities to actualize their potentials, to cope with normal stresses of life, work productively, and make meaningful contributions to society. We do this through our training seminars, workshops, and conferences on the issues of mental health promotion, peak performance, management consulting, and personal development. Among trainings, seminars, workshops that we have done for individuals and organizations like this, Network Consult also holds the Strategic Planning and Goal Setting Seminar in the first week of January annually, as well as the Financial Independence and Wealth Creation Seminar on the 1st of October every year. We also have the issues of mental health promotions on the 10th of October, which is the World Mental Health Day, as well as the 26th of June, the International Day Against Drug Abuse and Illicit Trafficking. We invite you to avail yourself of any of our trainings, workshops, and conferences at Network Consult so that you can have the life of abundance that you deserve. Thank you very much.
Network Consult. Everyone needs a push in life. Anybody can be somebody.
guest today is Dr. Emmanuel Innocent. Dr. Emmanuel Innocent is a senior lecturer in the Department of Histopathology of the University of Jos and Consultant Pathologist at the Jos University Teaching Hospital. He's a fellow of the West African College of Physicians as well as the National Postgraduate Medical College of Nigeria. Dr. Innocent, welcome to the program.
Good evening, viewers in Jos and beyond. It's nice to be with you on Networks.
Yes.
Thank you.
Thank you very much. It's good to have you here too. Our usual pattern is to get to meet you first. Your background, your family background, your ethnicity, your educational pursuit or journey until now.
Well, I am, as I have said, Dr. Innocent Emmanuel. I am from Pastor Local Government of Plateau State.
Okay.
I did my education. I was born in Borno, that is Maiduguri. I was born some years back in 1980.
Okay.
And I schooled in Borno, schooled in Makodi, in primary school, secondary school. And I further went to the University of Government College, Jingri.
Okay.
And then finally I went to the University of Jos and graduated as a medical doctor. And then I enrolled into the residency training program with the Jos University Teaching Hospital. And in 2014, I qualified as a consultant pathologist with the medical college, that is the Postgraduate Medical College of Nigeria.
Okay.
And then in 2015, I also bagged the fellowship of the West African College of Physicians.
Okay.
I've been a lecturer with the University of Jos, and currently I'm a senior lecturer, as I said earlier, and I've also been working with the Jos University Teaching Hospital as a consultant pathologist.
Wow. You are one of the people I like to call double star general, where you have the fellowship of both colleges.
Yeah, thank you, sir. Thank you, sir.
Right.
Yeah.
And now I'm curious. Most people that are doctors like to see patients and all that, but you now, you went into histopathology, doing autopsy and all the likes, and reading slides and all that. Like, what made you go into this area?
Usually, we pathologists consider ourselves as the Supreme Court of Medicine. In the Supreme Court of Medicine, that's where everything is being done.
So we say you made the final diagnosis.
Final diagnosis. For instance, you cannot take out maybe somebody's foot. You cannot take out somebody's breast mastectomy without the consent of the pathologist. So you have to be given consent by the pathologist before you execute anything you can do in the human body. Although the meeting point between us and psychiatry is actually very clear. But thank God that
maybe the forensic part that we're going to talk
actually
about.
that's actually where we and the psychiatry actually meet, especially in the case of rape.
Now, like I said before, we have been talking about rape. We have brought a psychiatrist here to come and talk about the psychological impacts of rape. We have brought a gynecologist to look at, because usually men can be raped, but most of the time is the female folks and all that. However, I thought that it will not be complete without, like you said, bringing the forensic aspect, which is where the pathologists come in. That's why we decided to bring you in here. Now, what will you consider as rape from your own perspective as a pathologist?
Our definition of rape is not actually different from other people.
Okay.
I believe by now you will have had so many versions of the definition of rape. However, there are some things that are actually synonymous to definitions. We can define rape as any sexual assault that involves sexual intercourse or any form of penetration without the consent of the individual. Now, we are talking about penetration, either penetration of the genital organs, either penetration of the other orifices that people consider as sex. We talk about anal sex, we talk about oral sex. So all these things are considered as penetration. But the important word there is the lack of consent. You know, when you do anything forcefully, that have legal implications. You are going into somebody's privacy, going into somebody's comfort zone without him allowing you to come in. Even in the hospital, you have to give us consent before we treat you. You come to the hospital and give consent that you are sick and you need treatment. So in the issue of rape, you are invading into somebody's social aspect of his life, both physically and otherwise. It involves penetration. We know that we have so many other sexual assaults But when there is penetration of any part of any orifices that is sexual in nature, it is being considered as rape. So the lack of consent constitutes what we call rape, and it's a very important topic in our world today.
Okay. Thank you very much for that. I'm sure our listeners are already used to getting the understanding of that lack of consent and all that. I'm also curious. There was the case of somebody that they talked about. They said even if they give consent before and then afterwards consent is withdrawn, you know, can people withdraw consent in the middle of the act?
Indeed, you can actually withdraw consent, because consent, there are some mannerisms that somebody might misconstrue to mean consent, and they are not consent. And sometimes the consent can be overt, but in the real sense, somebody can withdraw the consent. And you know, the rape can actually involve a wide range class of people. It can involve any age, it can involve any sex, any gender, could also be involved in rape. So in the course of the engagement, in the act of sexual intercourse, someone might decide that he doesn't want to progress with the procedure, and therefore that should be withdrawn. So actually, consent can be withdrawn in the course of.
Wonderful. That when people say for the no be firewood, the thing that they hot, and then consent is withdrawn. That's an interesting area. Now we know that many people get into many people fall victims. You know, most of the time people blame the victims. They say they dress in one way or the other and all that, but that's not the topic of today. When people find themselves as victims of rape, what should be the first line of action?
The first line of action is actually for you to report the case. You must report the case to the police, and then immediately you are being taken to the hospital for examination.
Okay.
Now we have had cases, and the rape is actually an underreported case.
Okay.
There are many other sicknesses or other vices, like theft and other things that have been reported. But because of so many social reasons and so many other reasons in our societies, rape is found to be underreported.
Okay.
We are calling on people to stand up for their rights, stand up for the society, stand up for morality, and stand up for what should be done accordingly. We are being called to report the case of rape. Do not hide. Go immediately and report the case of rape to the police. That is the first step. That is the first port of call. Go to the police and report. And then the police should not keep the victim there in the police station for a long while. The next thing is to take the person to a center where the person will be examined to ensure or to establish the fact that rape has actually taken place.
Okay.
Because sometimes some people might give false alarm that they've been raped. You know, some people can actually be victimized that they've raped somebody or not. So an important aspect of it is that the person should report the case to the police, and the police should take the victim to the hospital for the case of rape to be established.
Okay.
And there are many ways of establishing the case of rape.
Next question I wanted to ask.
Although we in a developing country like Nigeria, where things are not actually what they should be, we are having some problems in actually coming to terms with the international best practices of identifying what rape constitutes.
Okay.
You know, we are faced with so much challenges in our country today that have led to so much of medical tourism. We don't believe in our system. Therefore, we don't have funding. Like the government have not been funding health as should be. So therefore, we are not at the optimal place of actually establishing the case of rape. So now, when somebody is brought to the hospital as a case of rape, the first thing is the doctor do so many things to establish that the rape has been done. However, before the doctor goes into doing these things, there's a part that the patient needs, or the victim needs to actually play to ensure that those evidences are being maintained or are being preserved.
What are those parts?
For instance, if someone is raped, additional to the responsibility of reporting the case, there's also another responsibility of keeping those evidence intact. Number one, the person should not take off his clothes or throw off those clothes. You can still be on those clothes, or you can remove those clothes and take them to where you want to go. For instance, if they are tattered or something, you can take them to the police station.
Okay.
And that's one. There are so many evidences that can be found on the clothes.
Okay.
The assailants, or the person that have raped the victim,
Yes.
might leave some traces on the clothes.
Okay.
This can involve it can be the semen,
Yes.
it can be the blood,
Okay.
it can be the hair, and so many other things
Okay.
that the assailants might have left on the path of crime.
Yes.
And also, apart from the clothes, now we go to the person's body.
Okay.
Do not comb your hair or try to look beautiful before you go to police station.
Okay.
The person might have left some evidence in your hair.
Okay.
So you leave your hair that way. And also, don't brush your teeth.
Okay.
Leave it the way it is.
Okay.
Some people will just go brush their teeth and then they will destroy the evidence.
Mm.
And also, the person should not wash off.
Okay.
Don't take your bath.
Okay.
Because in taking off your bath, the water, the sponge, and all other things you're going to use are going to take off all those evidence. No matter how your nails are, don't remove your nails or don't wash them. There could be some evidence during the struggle period. You will have forgotten some samples that will be important under your nails that will be used. There's what we call douching.
Okay.
There are females that have been assailed, or males or otherwise that have been assailed by the rapist.
Yes.
You understand? You go, you wash your private part, clean it up. That is what we call douching. So you don't do that because you have to leave some of the evidence of the penetration that the person have done. So you leave all those evidence intact. So essentially, you have to leave everything the way it is when you report to the police station or you report to the authorities. Because anything that you have done to tidy up will have led to the destruction of the evidence that will be used to actually ascertain that rape has actually taken place and who is the culprit in this case.
Wow, that's a lot that you have given us there. I hope that our listeners, our viewers at home, are taking note of some of these things. And because usually when people are raped, one of the things, the psychological effect of it is that they feel dirty, they feel used and all that, and people will want to immediately get to the shower to clean off everything. You see some people, in fact, the way they are scrubbing their body is not the normal way you scrub. They do it as if they peel off the skin and everything. And you are now saying that they should leave everything there intact like that so that they can get evidence of that rape. What about the psychological? Because how comfortable do you think patients will be coming to the hospital like that? What do you do to ensure that the person is at ease, at least when you are doing the examination and all that? Are there ways or procedures that you ensure?
Yeah, actually, all over the world, rape is a disgusting act to the victim.
Okay.
It's also a stigmatizing act. So the victim is not happy about what has happened to him or her. That is actually what has led to the underreporting of rape globally. However, in the advanced world, like America, they actually report rape more readily than we here.
Okay.
But here, because of our culture, the stigma, the disgust, and so many other things, we have not been reporting rape optimally. So it's understandable when someone that has been raped, a victim, try as much as possible to destroy all those things, try to look good, like try to appeal to yourself, because actually there is both physical trauma and psychological trauma to the person that has been raped. So it's understandable that somebody wants to actually destroy or look good as he reports the case. That is when the person have the guts and the conviction to report the case. However, in trying to report rape, or in the society generally, we should try to ensure that every wrong deed or any act of wrongdoing is prosecuted and the person penalized.
Okay.
So I will call upon all of us that are listening, who, God forbid, might be victim of rape or might be around the area where rape has occurred, to ensure that they educate people that they should not destroy those evidence, because we have a responsibility to our society, we have a responsibility to ourselves to ensure that that person that has committed that rape is being punished, so that he will not continue and go around and also commit rape to other people. We've had cases whereby somebody that has committed rape is even just general, somebody that has stolen things and he has not been cautioned, has not been punished, he continues going around and committing the same offense. The same thing with a serial killer. You kill today and you go scot-free, you continue going around and doing the same act. So we should preserve those evidence and ensure that we don't take our baths, we don't comb our hair, we don't do douching, we don't also brush our teeth, we don't tear off our clothes or burn them. We should maintain all those evidence and go to the police station, report, so that those perpetrators of this crime will be dealt with according to the law of the country.
Thank you very much. It seems to me, of course, you are a pathologist, so I can understand why the forensic aspect is also an important thing where you are concentrating on. But what are the other reasons why people need to get medical attention beyond the issue of preserving of evidence? Do you work with other specialties in dealing with the issue of rape, and what are the other medical conditions that you want to deal with when somebody has been raped?
Actually, approaching rape is actually a multidisciplinary study.
Okay.
For instance, every part of medicine is involved.
Okay.
The forensic pathologist is involved. The other people in the forensic fields that are not medical personnel are involved. Okay. The nurses are there, they are involved. In fact, they are also at the forefront because the police, the law, everybody is involved. So now in the hospital, let me focus on the hospital.
Yes.
When somebody comes to the hospital, there are so many complications that can arise from rape.
Yes.
For instance, the victim might have physical injuries.
Okay.
These injuries can be bleeding, can be lacerations,
Yes.
it can be some trauma, some trauma that are not obvious, that are not overt. Somebody will be feeling pain, but it's not overt physical pain.
What do you mean by overt?
It's not visible to the eye.
Right.
The person probably he has been punched, he has been malhandled, and he's feeling pains, but there is no scratch on his body. Understand? So the person might be bleeding and many other things. Understand? So that aspect is a complication of rape. And then also there is another trauma that is psychological, which I believe you, the psychiatrist, you know better about that. The psychological trauma, the post-traumatic stress disorders, and many other depression and many other things that can come. That's one of the aspects that has to be dealt with by the psychiatrist and also the psychologist. And also we talk about sexually transmitted diseases. Somebody that is on the go for rape might have some diseases that he can transmit to the victim. And we talk about pregnancy. Pregnancy also can be contacted. And we talked about HIV and so many other diseases that can happen. And in some cases, the rape victim might have been so manhandled that he could also die from the rape immediately.
Wow.
And the stress disorders that actually could come to the victim can lead to even suicide, and can even lead to destructive tendencies. Somebody go on committing homicides and other things in the society. So actually, the effect of rape, that single act, is far-reaching, is all-encompassing, and has to be dealt with the whole range of personnel that are involved in this issue of rape.
So who are these people that are involved in the medical aspect?
In the medical aspect, usually the gynecologist is very important.
Yes.
The family physician or the physician that is going to attend to the person is very, very important. The psychiatrist is very, very important. The psychiatrist who, after the long run doing much, who actually call also the psychologist to talk to the patient. We can, and then importantly, the law also is also involved. The forensic pathologist or the pathologist is also involved, and the forensic scientist is also involved. The scientists also in the laboratory, they are also involved. The police, the law are also involved in it. And then also the nurses are there to take care of the patient, to also help in the preservation of all those evidences, and then to ensure that everything move accordingly, so that we have a holistic approach to the rape. So in that case, the patient is being kept alive in a good state, and also the victim is being trailed by the evidence that he has left on the path of crime. So we can also ensure that everything is treated holistically and everybody is good for it.
Thank you very much, Dr. Emmanuel Innocent, for that very lucid and enlightening presentation that you have given us. Viewers at home, we have been talking about rape thus far from the forensic pathologist perspective, and you will agree with me that while rape is not an interesting thing, but the dimension with which he has been talking about it is rather interesting in the sense that to preserve the evidence, to make sure that the person is alive, to make sure that medical complications are prevented and all that. It's an holistic thing and it's a multidisciplinary thing. We shall be going on a short break now. When we come back, we shall be opening our phone lines so that you can join in the conversation by making your comments and asking your questions. Please stay tuned and don't go away. Hello there. Hello there. My name is Dr. Kingsley Mayowa Okonoda. I'm a consultant psychiatrist and certified management consultant. I'm the Chief Executive Officer of Network Consult Training and Development. At Network Consult, we help individuals, organizations, and communities to actualize their potentials, cope with normal stresses of life, work productively, and make meaningful contributions to society.
My name is Oyewumi Olufemi. I've been following Dr. Okonoda for a while, but last year, October 1st, I attended a seminar at NetWealth. I've been having great fears in starting up a business, which I had lots of plans, they were just on paper. But after I came to the program, he said some things that just made me forget about my fears. My business has started and it's doing very, very well.
At Network Consult Limited, we invite you to avail yourself of our trainings, workshops, and conferences so that you can have the life of abundance that you deserve. Thank you very much. Welcome back. We have been talking with Dr. Emmanuel Innocent. He's a senior lecturer in the Department of Histopathology of the University of Jos, and also the consultant pathologist at the Jos University Teaching Hospital. He's also a fellow of the National Postgraduate College, Medical College of Nigeria, as well as fellow of the West African College of Physicians in the Department of Pathology, the Faculty of Pathology. Dr. Innocent, thank you very much. If you want to join our conversation, our studio numbers are on your screen, and our SMS numbers are on your screen. Let me say once again that if you are calling us, please lower the volume of your TV set and talk to us and hear us through your phone set so that we can have a good conversation. And please send SMS only to the SMS line. You can also make your comments on our Facebook page as you see it on the screen there. So, Dr. Innocent, we have a caller. Hello? 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 Okay, we lost that call. All right. We have been talking about the examination of the I like to call them survivors. All right, we have a call there. Hello? Yes. What's your name and where are you calling from? Okay, Annie George from Dadinkowa. Can you make your contribution? Yes. Yes. Okay. All right. Okay. Thank you very much. Just stay tuned. Your question will be addressed in due course. Thank you very much. Hello. All right. We note that call. Like I was saying, you talked about the forensic examination and everything. What is the difference between the forensic examination and the normal medical examination? Is there a difference, and what are those differences?
To a large extent, they are similar examinations. However, the forensic parts, the physical part, tries as much as possible to see the extent of damage.
Just hold that thought. Okay. Hello? Hello? Yes, what's your name and where are you calling from? Alright, we lost that call. We were talking about the difference. Hello? Hello? Please, if you are calling us, be bold enough to talk. Don't be shy. We are not rapists. All right. Okay, we have another caller. Hello? Yes, what's your name and where are you calling from? Can you talk loudly, please? Hello? Okay. We lost that call. So the physical exam.
The physical examination, the whole essence is actually to keep the patients alive, to know the extent of damage, and then to treat the patient.
Okay.
While for this, for the forensic aspect, is to take evidence so that we can nail the assailant at the point of crime. Because he must have done the crime, he has escaped, and then so we want to actually put him at the scene of crime. So what actually happens is that the victim might have seen the person that has raped him or her, and then
Hello? Yes, what's your name and where are you calling from? Okay, please, can you go ahead? Can you ask your question? Okay. Hello? Okay, we lost that call. All right. So, the assailant is to be nailed.
It's to be nailed, actually. So that's what we do in the forensic aspect. So the forensic aspect is mostly about getting the evidence. So it can be semen, it can be blood, it can be the person's hair, or any the skin or any part of the person that will have been preserved, his saliva or anything that he has left on the tract. So that's what the forensic examination seeks to actually get.
And now, any judge from that inquiry asks that if any of those things are not preserved, are we saying that the person will not be given attention?
Yeah, there's what we call circumstantial evidence.
Okay.
For instance, if you have a witness that person has committed the crime, and then there is evidence of penetration, so you can tie that together in the court of law and actually see that it's that person that has done it. However, the person might deny it. We live in the world of evidence. So the circumstances and the evidence without those ones, genetic evidence or those ones, nobody can deny it. You are the one. Your blood is on the clothes. You've identified that you are the one. It's your semen. It's your skin. You cannot deny those ones. But circumstantially, that can be used and also, and then the person can actually be named.
Because a lot of people will say that it's very difficult to get judgment for the rape victim, that people are hardly convicted in the court of law. It seems to me that what you are saying now is the way out. Before you answer that, let's take this call. Hello? Yes, what's the name and where are you calling from? Okay. Okay. Whether a woman. And what are the medical implications of a woman raping a man? All right. Thank you. Just stay tuned and you'll be answered in due course. Hello? All right. We lost that one there. Hello? All right, go on. I'm listening. All right. I think that's a young person that. Yes. Hello. Okay, Kate. Can you ask your question? All right. think Kate is shy or... All right. Hello? Hello? Yes, go ahead and make your contribution. What's your name? Timothy. Okay, from Gindiri. Okay, go on.
I want to ask questions.
Please go ahead. Oh, okay, it's all right. Thank you very much. Just stay tuned, it will be answered. Medical implication if a woman rapes a man.
Yes.
All right. Thank you very much. It's all right. So, okay, we have another call coming in. Hello? People are really... Hello? All right. The men folks are really asking if a woman can rape a man and what are the medical implications. Maybe you just go straight to answering those questions.
Actually, a woman can rape a man.
Okay.
You understand? Rape actually can occur across gender. For instance, we've had cases whereby women have gang raped men.
Wow.
You understand? You know, raping, when you rape somebody, he has not given consent. Therefore, even men too can fall short of giving consent.
Okay.
There could be men that are unconscious.
Okay.
There could be men that are physically not strong.
Okay.
There could be men that are psychologically not able to give consent.
Okay.
There could be men that will be coerced either by their bosses, coerced by other people, by some influence. You understand? And without giving consent, they could be raped.
Okay.
You understand?
Okay.
And raping a man, there could be a rape that could be from the oral or orifice. There could be rape that could be...
Just hold your thoughts. We'll go into the... Let's take this call. Hello? You are on to Mind Wealth for Life and Living. What's your name and where are you calling from?
Good evening.
Yes, good evening.
Joining the school and learned something today.
Thank you very much. But can we get to know your name first?
He was like saying with a woman or a man is doing this. They don't make anything. You have to run the conversation like that.
Okay.
So the fact that you're doing this doesn't mean that everybody should know that you're doing this. So I wonder why you shouldn't wash your teeth, you shouldn't put on your clothes, even though it's short aspect of the rape and other things. So I would like to enlighten us, and as a student, I understand because it's really weird actually. I don't know.
All right. Thank you very much. The doctor will answer you in due course. Just stay tuned and make sure that you don't leave. Hello? Hello? All right, we need that call. Okay, we have another one coming in. Hello? Yes, good evening. What is your name? Adamu from Low Cost. Okay, I'm sorry about that. We get a lot of calls and texts. Now you have your chance. Can you ask your question? Okay. 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 Oh. All right. Thank you very much, Adamu. You heard him that a person was raped. The accident was caught. The victim was taken to the hospital. They did the examination. They took the accident to the police station and everything. And that at the end of the day, both the police and the doctors were advising them that they should not even do anything about it and all that. What is your take about that? Because it's a serious issue. He's saying that that's one of the reasons why people don't even want to bother to do anything about it.
We actually live in a corrupt society.
Okay.
A society that is studied with so much ignorance. For instance, I don't see why the police or the medical personnel or the society will not be interested in seeing that justice prevails. We have seen a case recently, I don't want to call names, about the clergy and one woman that happened, and her husband pursued the case. Whether it's true or not, but we know that the husband pursued the case in the public glare. So I think it's time for the society to stand up and ensure that the right thing is being done. We should not be complicit as doctors or as police in this regard.
All right. A lot of people have said, okay, you are talking about the medical implication of a woman raping a man.
Yes, some men can be traumatized. The same thing that a woman go through can also happen to men. For instance, a man also can get some sexually transmitted diseases. He can get some HIV. He could get bruised. He could even die immediately. He will have post-traumatic stress disorder.
I know that. Hello? Yes. What's your name and where are you calling from? You say Samuel from Jos. Can you make your contribution? Samuel. Okay, I think we lost that call. Hello? What's your name and where are you calling from? Gabriel. Okay, what's your contribution? Alright, sorry, I can't make much out of that. So you were talking about the effects that one can get out of a woman raping a man.
Men have actually been raped, and rape can also involve not really the assailant using his genital. He could use other things. He could use his finger. He could use other objects to actually rape that individual. And also, the woman can gang rape a man against his wish. It can make him exhausted, and some people have even collapsed or died, and that has been traumatic for so many. So what women feel, men also feel. And I think we should actually stand up to the fact that it's not only women that are being raped, men too can be raped. And then don't fall a victim to such a problem as a man.
Yes, thank you very much. We have some comments on Facebook here. He said, Joro Nuhu said, yeah, that is true, because proof of rape requires proof of actual penetration. And without this proof, the court cannot convict the accused person. So that still goes on to buttress what you have said. Another person here. Okay, Pamsong David says, I've been trying to reach you during the program but couldn't. All right, we will get back to you after the program by Pamsong David. Somebody asked, why do you need to preserve all the evidence? We will go on a short break now. We will continue on that wise when we come back. Listeners at home or viewers at home, I'm sure that you are following our discourse with Dr. Innocent Emmanuel. We are going on a short break now. Stay tuned and don't go away.
Welcomes up. Everyone needs a push in life. Anybody can be somebody, through development and building one's capacity, financially, health-wise. Everyone can be better.
My name is Dr. Kingsley Mayowa Okonoda. I'm a consultant psychiatrist and certified management consultant. I'm the Chief Executive Officer of Network Consult Training and Development. At Network Consult, we help individuals, organizations, and communities to actualize their potentials, to cope with normal stresses of life, work productively, and make meaningful contributions to society. We do this through our training seminars, workshops, and conferences on the issues of mental health promotion, peak performance, management consulting, and personal development. Among trainings, seminars, workshops that we have done for individuals and organizations like this, Network Consult also holds the Strategic Planning and Goal Setting Seminar in the first week of January annually, as well as the Financial Independence and Wealth Creation Seminar on the 1st of October every year. We also have the issues of mental health promotions on the 10th of October, which is the World Mental Health Day, as well as the 26th of June, the International Day Against Drug Abuse and Illicit Trafficking. We invite you to avail yourself of any of our trainings, workshops, and conferences at Network Consult so that you can have the life of abundance that you deserve. Thank you very much.
Network Consult. Everyone needs a push in life. Anybody can be somebody.
We have been talking with Dr. Innocent Emmanuel from the Department of Histopathology of the University of Jos, and we have been talking about rape. There have been a lot of questions and contributions from your side. But before we go on to conclude the conversation, I have here once again Stephanie from Network Consult. Stephanie, can you introduce yourself and why are you here?
All right, my name is Stephanie Invertab. I'm the Training Development Officer for Network Consult, and I'm here to talk about our other special training program once again.
So tell us about what do you have in stock?
Okay, for this month of August, we're actually doing a training course on suicide prevention and resilience training course, which will be coming up on the 24th of this month, and we have another one on the 31st of this August as well. That will be on understanding mental health and mental health illnesses for the layman. So we're going to be doing like more of an expose to what is suicide and what are the prevention, what are the care, what are the signs, because actually suicide is preventable. You just need to teach people to be proactive, not to be reactive, rather. So this training course is going to give you the opportunity to learn and understand more about suicide and how to manage it.
Who are the people that are going to be taking this course?
Okay, we have mental health specialists, professionals in that field, people, the likes of Professor James Obindo, he will be one of the facilitators. We have Dr. Anna Gyang as well, she's a consultant psychiatrist as well, and yours sincerely himself, Dr. Kingsley, will be there also.
All right. And when people, are they supposed to just come and freely get the thing? Freely
No,
are you giving?
This Maran is not a free training program.
Okay.
Okay, it's not a free training program. It's a paid program. Each participant is better to pay 10,000 naira. But of course, we have a special package for early bird registration. So if you register from now till the 14th of this month, you get a 20% discount, which is instead of paying 10,000, you pay 8,000 naira.
For both programs?
No, that's for one, for
okay.
the suicide prevention and resilience training, because that's 8,000. That's if you pay now before 14th of this month. Then if you pay for the one for the 31st of this month as well, now it's going to be 25% discount. So you, instead of paying 20,000 naira, you pay 15,000 naira.
That's if you are paying for the two
for
together.
the 2 years. For the one for the 24th of this month and 31st, you will pay 15,000.
And when you pay this money, what are the packages you get?
All right. There's going to be lunch as well. We're going to feed you, and you'll be given training materials so you can consult and read from time to time. And also, there's going to be issuance of certificates to participants.
All right.
Yeah.
All right. Thank you very much, Stephanie. We hope that you have been getting some registrations and all that.
Yeah. In fact, we have limited space, so we have like 30 more to go. So the earlier you register, the better, so you'll be able to handle your space. Yeah.
Thank you very much. I'm sure that Dr. Innocent will also propagate the message, and he will be there as well.
Okay, okay. Let me tell you. So people, we're expecting health workers of all types.
Okay.
We're expecting counselors, social workers.
Okay.
We're expecting the military, the police, paramilitary as well, teachers, school owners, and NGOs, parents of course. In fact, it's for everybody because suicide is no respect of anybody.
Yes.
Yeah. So everybody's.
Thank you very much, Stephanie, and we'll be looking out to see as many people there as possible so that we can curb the menace of suicide.
Yeah. However,
we need to conclude our discussion. Dr. Innocent, Emmanuel, thank you very much for what you have taught us thus far. There is a question here. The person says it is ridiculous that you have said that people should preserve, should not wash, should not brush their teeth, and all those kind of things. And he said you need to explain to him why.
Actually, it's disturbing for you to just, you're battered and you just go to the police station, public glare. It's actually discomforting. But what I feel is that you are trying to actually get something done. So at all costs, you should try to make sure that that is being done. Well, if you want to change your clothes, don't throw it away. Don't throw it away. Remove your clothes, put a new clothes, but put that clothes in a pack and bring it to the police station.
Okay.
And also, but it is it's paramount that you don't do other things. You leave your body the way it is.
Are there things you do as medical personnel, maybe confidentiality, privacy, to make sure that people are at least a little bit comfortable?
Actually, when you're going to the police station, nobody knows where you're going. You board a bus, you go there. When you go to the police station, you see there is a confinement. You go to a room, and then all the questions are being asked, and immediately you're rushed to the hospital. So when you come to the hospital, we believe in the principle of confidentiality. In the hospital, confidentiality is the watchword. We know of so many people's sickness and we don't tell nobody. And also, we keep it confidential of what is happening to you. So you don't have anything to fear. You'll be examined in a separate room where nobody is present.
Thank you very much, Dr. Innocent. We have a lot of SMS here. Time may not permit us to be able to take all of them. I will implore our viewers to check our Facebook page and drop all these questions there. I will also attempt to answer all these questions on the Facebook page. However, for the purpose of this program, just before we go, Rebecca says, "Good day, sir. What if in the process of defense during rape, the victim mistakenly kills the rapist? What happens?" That's Gabriela from Abattoir.
Self-defense is actually accepted everywhere.
Okay.
When you by mistake you kill somebody in the process of self-defense, you have a case in the court of law.
Okay.
The person comes to assail you and you defend yourself. So anywhere you'll be exonerated because the person actually came to you to invade you.
And this person, well, no name, but the information is important. He said, "I think the police should have a separate office where rape cases can be reported and not at the counter." Well,
yes, in developed clients, that's what obtains.
We will bring the police people by God's grace next week so that they will come and enlighten us on how they go about it. Sunday Uzoka from Kufang Miango says, "Good thinking, good program. Keep it up. The program is educative and inspiring. Good job." Thank you very much, Sunday. Let me see if we can take one or two more. Aziz from Lamingo says, "Please, something like that." Okay, I can't really understand. Okay, he said, "Let's not just discuss it and let it go." Well, the program is not, the message is not complete, but we are trying to do all the best we can. He said, "It's the only boys that can be raped, that rape, do women also rape?" We have answered that over and over again. Happiness from Bassa says, "How does it look when a woman claims that she has been raped? Why she didn't shout when the incident happened? Will that be called rape?"
It will be called rape. She didn't give consent.
Okay.
The fact that she didn't shout doesn't mean that she has not been raped.
Okay.
Probably her response to the rape might have been by keeping quiet.
Yes.
She would have been under shock or other things.
Some people are too shocked to shout. And some people don't even want anybody to see them. It's embarrassing. Yes. So it says, Samuel says, "Is it possible for a teenage boy to rape an adult lady?" Yeah. And says the reason why women rape men is because when women are tempted to have sex, they meet any man that they see and force them to have sex. I don't understand. I don't understand that one.
The person might explain better, but he has given the message.
Okay, it's all right. And Ahmad Yusuf from Saya Zabolo says, how can woman rape man? What is the implication? I think we have already said that. Thank you very much, Dr. Innocent Emmanuel, for coming on our program. Today has been very educative and enlightening, and I'm sure that most of our, if not all, of our viewers are better informed. I also want to thank you, Stephanie, for the information that you have given us, and we hope that all our viewers will be there so that beyond just talking about it, like somebody said we should do something, come and equip yourself with skills to be able to handle the issue of suicide and the issue of mental illnesses as they are now. We get a lot of calls concerning suicide almost on a daily basis. So I want to thank everybody that have made this program a success. I want to say that you can still join us on our Facebook page. The Facebook address is there on the screen so that you can drop your comments, continue the conversation, watch clips of past past episodes. Thank you very much. You can also still send your text messages to our SMS line as you see on the program. I still remain yours sincerely, Dr. Kingsley Mayowa Okonoda, saying bye for now and God bless you.
Everyone needs a push in life. Anybody can be somebody, eh? Through development and building one's capacity, financially, health-wise. Everyone can be better, 'cause we're taking you higher, eh? You can be entertaining, so educated, making you so independent through